Good morning. My name is Matthew Morogbe. I'll be representing Group 3 for project presentation. And our topic is, can we talk about sex? Content include case summary, case analysis for question 1 and 2, as presented by Shinais. Question 3, case analysis by Ryan. Question 4 by Belinda. Question 5 by Matthew. Conclusion and references. This case involves a 3-year-old girl who undergoes a routine inguinal hernia repair, during which the surgeon discovered that the patient has undescended testes rather than ovaries, indicating that the patient is a male instead of the female sex assigned at birth. After consulting a pediatric endocrinologist, the surgeon decided to perform a gonadectomy without full disclosure to the patient and her mother. The surgeon also failed to obtain consent for the gonadectomy. Please read full case study from Canvas. What is the ethical dilemma? Recount all relevant factual information. In step 1 of particular discernment process, we focus on understanding the relevant facts. This case involves a 3-year-old girl who undergoes a routine inguinal hernia repair, during which the surgeon discovered that the patient has undescended testes rather than ovaries, indicating complete androgen insensitivity syndrome, CAIS. CAIS is a condition where an individual with a male XY genotype has female external genitalia due to the body's inability to respond to male hormones. This means that although the child appears automatically female, she is genetically a male. After consulting a pediatric endocrinologist, the surgeon decided to perform a gonadectomy to reduce the risk of cancer associated with undescended testes in the abdomen. The ethical dilemma arises when deciding how much to disclose to the child's mother, following the endocrinologist's advice. The surgeon plans to inform the mother only that the gonads are abnormal and incapable of producing eggs, without revealing the child's XY genotype. The rationale is to protect the mother and child from potential harm. So the surgeon did not obtain consent for the gonadectomy. And the ethical issues in this, or the key ethical principles at stake, include autonomy, the mother's right to comprehensive information about her child's condition, beneficence acting in the perceived best interest of the child and mother, malfeasance avoiding potential harm by withholding certain information, and paternalism overriding the mother's right to full information based on perceived benefits. Identify stakeholders who will be affected by the decision and what is at stake for them. The primary stakeholders in this case include the child, her mother, the surgeon, the pediatric endocrinologist, and more broadly, future healthcare providers and society. Each of the individuals or groups stands to be impacted by the decision regarding disclosure. The child, although too young to understand the implication immediately, will be affected by her diagnosis, how it is managed medically and personally. If the full diagnosis includes her XY genotype, is withheld from her mother and ultimately from her, there may be consequences for her identity, psychological well-being, and her trust in her family healthcare providers as she matures. The mother is another key stakeholder. She is responsible for making informed decisions for her daughter's care. Without information about her child's XY genotype, directly affects her autonomy, limiting her ability to make fully informed decisions about her daughter's treatment and future. There's a risk that if she later learns about the genotype, she could feel betrayed, potentially damaging her trust in the medical team and impacting on her relationship with her child. The surgeon and pediatric endocrinologists are also stakeholders in the situation, as they are responsible for delivering care and support to the child and her family. Their decision impacts their ethical integrity, as they must weigh the benefit protecting the family from potential distressing information against the professional responsibility to be transparent. Their choice reflects their medical practice, setting and example for ethical standards in similar cases. Finally, there are broader societal implications. This decision empowers the ethical guidelines that will influence future healthcare providers dealing with cases involving intersex individuals or ambiguous diagnosis disclosure practices shape societal expectations, medical standards around transparency, autonomy, and the way we approach complex gender and genetic information in medical care. Identify the ethical issues, considering the various stakeholders and knowledge of ethical principles. What are the ethically relevant factors? Ethical issues we look at. So due to the risk of malignancy, if the testes were allowed to remain in the patient, an osteotomy indicated for these patients, an informed consent is then needed to perform this procedure while the patient was getting the hernia prepared. The pediatric surgeon consulted with a pediatric endocrinologist colleague who recommended not to disclose the male genotype to the mother, and this is veracity to tell the truth, honesty. This is also a paternalistic approach by the surgeon and endocrinologist, which they justify as necessary due to lack of significant benefit from full disclosure of the genetic abnormality. Excuse me. The surgeon made the decision to refer to the testes as goners when speaking with the mother. The true XY karyotype was also not disclosed to the mother. The rationale was that mothers and daughters fight, and it would be bad for the daughter to find out her true situation in the event it was disclosed by the mother in a moment of anger. Beneficence, autonomy, and non-malfeasance are all additional ethical issues raised in this scenario. Stakeholders involved are the patient, surgeon, endocrinologist, the hospital, and mother, or the patients. The mother of the patient is a minor, absolutely has the right to know the full information regarding her daughter's health and condition diagnosis. She did not receive that in this case. Determination for cases like this was made in 1988, a few years before this event, in 1993, that doctors would disclose fully the information to parents. Doctors believed that they were doing the mother and daughter a favor by withholding information. However, this is not their decision to make. The surgeon lacked training on how to deal with a parent and conversation like this as well, and should reach out to the people and obtain resources than just endocrinologists. Question 4. How does sensitivity towards some of the ethically relevant factors compare with sensitivity towards others? The ethical conflicts faced in this case include beneficence, autonomy, and non-malfeasance. The surgeon thought he was doing what was best for the patient, that is beneficent, but by doing this, he had back information from the parent. He did this because he was not personally ready to deal with the parent reaction because revealing that information could have changed the child's life that moment. The parent could not decide with autonomy because she was not given all the information. Had she been given all the information, a different decision may have been made. The surgeon acted with malfeasance by not fully disclosing all the information he had about the child to the mother to make full informed decision. It is paternalistic to withhold information from the parent and the child and decide that not giving them all information was best. Question 5. Which ethically relevant factors ought to take precedence? Why? Please use one or more ethical theories discussed in class step 3 from the discernment process. Consider what is right, relationship requires, and what leads ultimately to human flourishing. Informed consent, autonomy, benefits, veracity, and non-malfeasance are the ethically relevant factors that ought to take precedence in this case. Patients and the parents have the right to give consent and to make an informed and uncoerced decision about their care. The physician thought he was acting in the best interest of the patient, but little did he know that his action would hurt the patient and the mother. Telling lies and not disclosing the actual sexuality of the patient and her mother could cause harm to them in the long run. The patient could have benefited from social services, counseling, and social groups. Mercy College value of compassion, which implies displaying respect, empathy, and a willingness to listen was violated. Human dignity, justice, sacredness of the life of the patient was also violated. Question 6. What actions ought to be taken to respond appropriately to the most significant ethical relevant factors? We see this in step 4 to 6 of the examining process. Here we consider full disclosure of potential information. The surgeon should have disclosed the information to the parent at the time of finding so that the parent could have made a fully informed decision regarding the child. It's not standard practice to disclose this information to the parent or the patient to be able to obtain fully informed consent. The surgeon instead should have thought about how they could tell the parent and child information without making them feel overwhelmed. The surgeon could have used that moment to educate the parent about the findings and reassure her that things were going to be okay. With the information being withheld, the girl will likely not find out she has this issue until she is older and find she has not may be able to have children and does not have periods or not able to develop breasts. Question 7. What, if anything, can still be done to manifest sensitivity toward the less significant ethical relevant factors? The question above requires critical and thinking to provide general acceptable answers. The physician has an ethical obligation to benefit the patients, avoid or minimize harm, and to respect the values and preferences of the patients. According to AMA Council on Ethical and Judicial Affairs, Opinion 5.055, Confidential Care for Minors, 2014, physicians who treat minors have ethical duty to promote the autonomy of minor patients by involving them in the medical decision-making process to a degree commensurate with their abilities and encourage them to involve their parents. In this case study, the physician agreed to have violated the ethical issues of disclosure for the genotype to the patient's mother, and as a result, the ethical principles of beneficence, autonomy, and munificence were violated. Another ethical principle violated by the physician is justice. The patient has suffered harm, deceit, and malfeasance because the physician paternalized action. The question is, what if the patient or the patient's family find out the unethical practice of the physician from another source? How will they react? They will think they have been denied justice. They want to sue the physician for his unethical action of non-disclosure and denying them of the autonomy to make decisions. The only thing that is left to be done is justice for the patients and justice for the family. It does not matter how long, the physician can still approach the patients and patient family to tell them what had transpired. The physician should take responsibility for his unethical actions. He restitutes and compensates the patients and the patient's family. In conclusion, the ethical dilemma in this case is non-disclosure of patient information. Ethical principles violated have been repeated over and over, which include autonomy, beneficence, non-maleficence, veracity, and justice. And the lesson we've learned from this is respect for patients' autonomy and adherence to medical ethical principles. References? Thank you for listening.